Hello, and welcome back to Yodo. I'm Dr. Sarah Bohn.
And I'm Dr. Lisa Tartaglia.
And today we're going to provide some education on 4 different Ds for frail or elderly or geriatric patients: depression, dementia, delirium, and delusions.
Today's objectives are going to include, we're going to identify the 4 Ds, which we kind of already did, give you the definitions for them, elaborate on the commonalities as well as their differences.
We're going to talk about 5 different things related to depression, maybe even more than 5 things related to depression.
We're going to distinguish delirium from delusions.
And kind of discuss how some of these things can interact with each other, because there are subtypes of delirium. And we're going to talk about where we see those really commonly.
We're going to talk about predisposing factors to delirium as well as identify and discuss the reversible causes of dementia.
These 4 Ds that we're talking about: depression, where feelings of sadness or dependency; delirium, the disturbed state of the mind or consciousness, especially when it's acute, transient type condition; and then dementia, characterized by a persistent loss of their cognitive function.
And their intellectual ability. Delusion is a false belief or judgment about an external reality held despite an evidence to contrary. So you can try to talk to people that are delusional and tell them, no, it's really not snowing in your room. They are not going to believe you.
The depression part of it, depression can intermingle with these and kind of be interrelated with each one of these. But depression is that persistent feeling of sadness. It could be anxiety. Sometimes you've got the anxious, nervous person. Sometimes it's a motor depressed person, but they feel empty.
There's also feelings of hopelessness, guilt, worthlessness, or even helplessness.
They can become irritable. They can be restless, have trouble sitting still.
They've lost interest in things that are usually pleasurable activities, including sexual activity.
Eating, being with friends, communicating. Whether it's talking with a friend or a family member on the phone, but they've lost interest in things that they used to enjoy, whether it's sewing or knitting or working in their garage, but they just don't have that interest level anymore because they're tired, they're emotionally tired, and they don't have energy. They fatigue easily.
Delirium versus delusions. Delusions are part of a constellation of symptoms defining delirium. And it's a syndrome characterized by an acute onset of deficits of attention, awareness, and cognition that fluctuate in severity over a relatively short time span.
There are several subtypes of delirium, really primarily 3 subtypes of delirium. Hypoactive delirium, where they're more lethargic. That's probably the most common one that's encountered. And so family members may think that their loved one doesn't have delirium because they don't seem like they're, really off their baseline or really confused. They seem motor retarded. The hyperactive or the more agitated delirium is the one that certainly gets a lot of attention, but quite a few people have a mixed picture of delirium. They're hypoactive sometimes, and then maybe later that same day they may be hyperactive with their delirium.
Right, and it's important to know that the hypoactive delirium goes unnoticed, so oftentimes by the time we notice it as physicians, they may have had the symptomology for days, and sometimes it's harder to reverse if you don't catch it early.
We do need to address delirium, and it does need to be treated and reversed if at all possible. Sometimes the delirium occurs near the end of life, and thus it cannot be reversed.
Predisposing factors for delirium are the advanced age. Patients that already have underlying dementia, they will become delirious sooner than people that do not have cognitive impairment.
A person that's frail or has an acute severe illness, like somebody that's septic, has a high fever, that's in the hospital already and it kind of has their nights and days mixed up, they can have a lot of issues with delirium.
And sepsis is defined as an infection that not only affects one organ system, it affects the whole body because it's a blood infection throughout the whole system. So it can cause shutdown of the kidneys, and even the liver doesn't function well. It's very serious.
But a lot of cumulative illnesses, they add up over time and add up in their burden onto the person. Somebody that maybe has used alcohol or illicit drugs for a long period of time, somebody that's had severe depression for a period of time, somebody that's nutrition is not very good, either because of a process of poor appetite related to their depression, or somebody that has a problem that they can't consume their food or fluid. Maybe they've had a stroke, or maybe they've had a malignancy. But for somebody that's frail and losing weight, they're going to have problems with delirium.
People that have functional, visual, and hearing impairments, they also will have more problems with delirium. And then the big thing is people that have had delirium before, they're more likely to get it again. So it's really important to look at those patients closely when they end up in the hospital setting, or if they're on end-of-life care in the house, that you're aware of that could happen again.
Now we're going to discuss a little bit about some reversible causes of dementia. And I know a lot of family members and patients are concerned that their loved one's cognitive impairment is going to be permanent, but there are some types of dementia that are treatable.
Yes, we've used this D word a lot. It's a depressed patient. Depression can really cause intense feeling of sadness and worsening of mentation, because the patient is so apathetic and doesn't want to be involved that they're disjointed from their reality or their life, and they just appear that they could be demented because they're so disengaged.
They just withdraw. They withdraw from life and activities. And the more they withdraw, the more the depression advances and the more likely they are for that dementia to become permanent.
Medicines really play a role in reversible causes of dementia. Polypharmacy is really big in the geriatric population. Unfortunately, you have to really look at the medications, not only why they're being prescribed, but what are the side effect profile and how they interact with each other. Because older adults take many medications, they're more likely to get a reversible cause of dementia because of too many medications.
And I know many times patients have been told, you're going to take this medicine forever. It's not necessarily that they're going to take it forever. You're going to take it until your situation changes. So particularly like with a blood pressure medication, you're taking it to lower your blood pressure. So if your blood pressure is coming down naturally because of another process, or maybe you've lost weight, or maybe your stress level is less, or possibly you stop smoking and your blood pressure is less, you may not need that blood pressure medication anymore. Same thing with, a cholesterol medicine, or possibly one of those PPI medications that's helping reduce your acid. Do you really need those doses? Do you really need that medication at all anymore? So medication review and reduction of polypharmacy is very important.
Poor eating habits play a role. If you're vitamin deficient, you can have mentation changes. So it's really important to look at what you're eating, how much you're eating, and if you're in a well-nourished diet.
Heart and lung issues. If somebody's got advanced heart disease or advanced lung disease, they're certainly going to have problems with dementia. And improving their oxygenation, decreasing the strain on their heart is going to improve their cognitive function.
Thyroid illnesses. If your thyroid is not working, or your parathyroid or other glands in your body are not functioning correctly, they can also cause problems that look similar to those that would have dementia.
And then we've already discussed the infection. Somebody that's got an acute severe infection, and if it's a frail person, whether they're an elderly person or not, sometimes something as simple as a urinary tract infection or possibly a pneumonia can definitely affect their cognitive function. And treating that infection can improve their cognitive function.
Yes. And others may not completely improve. They may return to another baseline. So you have to really look at treating those infections quickly so there's not end organ damage. Illegal drug use and alcohol also causes reversible causes of dementia.
In conclusion today, we're going to reinforce these 4 Ds that we've discussed today: depression, delusions, dementia,
And delirium.
And delirium. Thank you. I'm not delirious. But we want you to have a better understanding that these all sound similar, but they're not exactly the same, and each one of them needs to be addressed in its own way. They can overlap, they can interact, and they can contribute to one another.
We have other information on this channel, so look at our other videos to see if you find anything else you would like us to elaborate on more fully. Please send us an email, drop us a comment, and send us an email if you have any questions or concerns that you would like to address privately. This is a really complex topic. We will break this information down for you more in the future by maybe having videos on each of the 4 Ds.
Because they're very significant. These 4 Ds are really important, so we can break it down more for you in the future.
Thank you so much for taking the time to be here, for sending this information to someone you need, and thank you for watching this video.
Bye now.
Bye now.